Hello, welcome to this short monthly video teaching of Safe Space Community for Asians. SSC seeks to equip you with holistic remedies for emotional and mental health difficulties from the medical, psychological, spiritual, and relational perspectives by integrating psychology and theology. This is session number 4. I am Dr. Edmund, a licensed psychotherapist, and I am your facilitator in SSC. The title of today's topic is Addressing Hidden Shame. You will learn, first of all, what is the nature of shame. Understand why shame is often hidden, why we need to attend to our hidden shame, then how to expose our hidden shame, and finally, how to resolve the shame within us. The main reference for this teaching video is based on a book that I've authored in the year 2021. It is entitled Shame-Informed Counseling and Psychotherapy, Eastern and Western Perspectives. This book has been published by Routledge, one of the top academic publishers in the world. And this book was selected by the editorial committee to be published as a hardcover monograph in recognition of its value, quality, and originality. It is carried in the libraries of many established universities such as Harvard, Yale, Oxford, and Hong Kong, to name a few. So let me start with a short word on the East-West distinctive of shame. Traditional Eastern cultures are more collectivistic, interdependent, and shame-based or face-saving. In other words, Eastern people are more concerned about what others will think about them, while traditional Western cultures are more individualistic, independent, and guilt-based or wrongdoing conscious. In other words, Western people are less concerned about what people will think of them, but more concerned about any wrongdoings that they have done, if they still have that conscience. So as an illustration, a miscarriage in the East can be viewed as shameful by the mother for failing to carry out the baby to full term, while other women have succeeded. This is because she is affected by how other people will think of her in failing to fulfill her expected role to bear children. So it is face-saving amidst other community members. In the West, a miscarriage is perceived as a biological loss only, which has nothing to do with the competency of the mother. There is nothing shameful, therefore, as she has not done anything wrong, because they are more guilt-based. Thus, shame in the East can also be considered as a virtue, while shame in the West is often considered as harmful or as a taboo. So, defining the nature of shame. What is shame? Allen says that shame is a feeling of pervasive defectiveness, and that defectiveness is against the core self. In contrast, guilt is a sense of feeling bad about one's misdeed rather than what one is. And Erik Erikson, the guru of psychosocial development in the lifespan, he says that shame is rage turned against the self. And Techney and others, the more modern the researchers, say shame is feeling bad about oneself. So what causes shame? Shame arises when there is a falling short of one's expectations of oneself or what others expect of oneself. And Sandler and others say shame arises because there is a difference between the ideal self and the actual self. So the bigger is the difference, the more propensity there is for shame. And let us understand why shame often stays hidden. And I illustrate this from two incidents from the Bible, starting with Genesis 3. This is after the fall of man, when Adam and Eve has eaten the forbidden food and thus sinned against God. Verse 7 says, "Then the eyes of both of them were opened, and they realized they were naked. So they sewed fig trees together and made coverings for themselves. Then the man and his wife heard the sound of the Lord God as he was walking in the garden in the cool of the day. And they hid from the Lord God among the trees of the garden. But the Lord God said to the man, 'Where are you?' He answered, 'I heard you in the garden, and I was afraid, because I was naked, and so I hid.'" And so what's the emotion of Adam, as mentioned in the Bible after the fall? We read earlier that the Lord God said to the man, "Where are you?" And Adam answered, "I heard you in the garden, and I was afraid, because I was naked, so I hid." And therefore, it is the emotion of fear that was first mentioned in the Bible. And what emotion is fundamentally present in "because I was naked"? Verse 7 says, "The eyes of both of them were open, and they realized they were naked, and so they sewed fig leaves together and made coverings for themselves." So that emotion was actually the emotion of shame, because covering up one's nakedness is the psychological hallmark of shame. Another illustration from the incident with Cain and Abel. Genesis 4 verse 3 says, "In the course of time, Cain brought some of the fruits of the soil as an offering to the Lord. And Abel also brought an offering, fat portions from some of the firstborn of his flock. The Lord looked with favor on Abel and his offering, but on Cain and his offering, God did not look with favor. So Cain was angry, and his face was so downcast. In fact, eventually, Cain murdered Abel because of this." Now, what are the emotions of Cain mentioned in the Bible after the offering? Verse 5 says, "But on Cain and his offering, he did not look with favor, and so Cain was angry, and his face was downcast." The emotions mentioned are therefore anger, because he was angry, and sadness, because his face was downcast. But what emotion is fundamentally present underneath the anger and the sadness? "But on Cain, his offering, God did not look with favor. So Cain was angry, and his face downcast." Cain lost faith with his younger brother, as the latter did the right thing and gained God's favor, while Cain did not. An older brother is supposed to know better, and so Cain was ashamed of himself. Therefore, the underlying emotion here is shame. The effect of shame often remains hidden underneath the surface emotions triggered by it. And hence, shame is not readily recognized and admitted by the person who experienced it. So it is said that shame is the most frequent and possibly the most important of emotions, even though it is usually invisible. And Gershon Kaufman says, shame is experienced by all people anywhere in the world. But in the American society, shame remains much hidden because the taboo of it is so strict that the people behave as if shame does not exist there. And Lewis have this to say, she is more psychologically minded when she says, shame can be so painful and it is often disowned, denied, or disapproved. And hence, shame remains outside of awareness and lies hidden behind secondary emotions like anger, fear, or grief. And so, Why shame stays hidden underneath? First, it is because of the unpleasantness of shame. Experiencing shame is unpleasant. And in many cases, the shame can be so intense or acute that it can even be painful just to feel it. Therefore, we unconsciously suppress it from surfacing. And another reason is because there is shame of shame. Shame of shame arises out of our anxiety of being assessed less than others. And so we regulate what we reveal about ourselves on the safe side to avoid risking ourselves to being shamed. And finally, the third reason is because there is no easy remedy for shame. The secondary emotions triggered off by shame are often those that one will readily admit, talk about, or rectify. With shame, there is no such ready or easy remedy. So why is it so important that we need to attend to the hidden shame? Number one is because shame is the master emotion of everyday life. And Gershon Kaufman says, indeed, shame is the principal impediment in all relationships, whether parent-child, student, teacher, or therapist-client. And that if we are to understand and eventually heal what ails the self, we must consider the effects of shame. In fact, it is said that there are vast empirical evidences linking shame to many psychological problems. Therefore, since shame is the root emotion that causes many of our psychological problems, if we want to offer a more reparative healing for people contending with these problems, we must ultimately trace back and attend to their underlying shame by surfacing it. So how do we surface this hidden shame? The key is the defense strategy, because this is the link. Now we know of people, and people come to therapy because they complain of certain presenting issues to us. Not knowing, without a clue, that what causes all these maladaptive or maladjusted behaviors is the hidden shame underneath. And the link here is the defense strategy, because the hidden shame, unknown to them, it releases unpleasantness if it's allowed to surface. And to relieve the unpleasantness, a defense strategy is adopted. But the overuse of this defense strategy will give rise to psychological symptoms that mask the underlying shame. And these symptoms are the presenting issues that we see in people, that people come complaining in their therapy. So what is a defense strategy? A defense strategy is an affect management technique adopted by a person, often unconsciously, to govern the feelings, cognitions, and behavior as a reactive phase of the shame experience in order to lessen the effect of shame. And the type of defense strategy that is adopted will depend much on the early child caregiver's past experiences of the individual, the inherent temperament that shapes one's personality, and the environment that the person is in. And Netterson says that there are 4 types of defense strategies: withdrawal, attack self, attack others, and number 4, avoidance. Now, the purpose of the withdrawal strategy works by becoming virtually invisible, silent, secretive, or isolated, to be away from the scrutiny and judgment of others, physically and psychologically, so that one cannot be shamed. And so this overuse of this withdrawal defense strategy will result in hiding, in one being shy, silence, lonely, superficiality, stuttering, anxiety, PTSD, being very highly shamed, vigilant, sensitive to rejection, isolation, low self-esteem, depression, sexual abstinence, and virginity. For the defense strategy of self-attack, this is adopted by engaging in the intentional derogation of the self and being differential, compliant, or submissive to others in order to gain approval, avoid the fear of abandonment, or deaden the inadequate self to annihilate the self within. And the overuse of the attack self-defense strategy will result in shyness, false modesty, self-depreciating humor, self-neglect, difference, self-injury, self-sabotage, obsessive-compulsive disorder, bulimia, anorexia, refusing medication, and even suicidal ideation. Now, for the defense strategy of attack others, this is adopted by projecting one's shame onto others and shaming them through becoming aggressive to overpower them or elicit superiority so as to escape one's own shame. And the unconscious overuse of attack other defense strategy will result in bully, putting people down, insults, anger, rage, sarcasm, hostility, aggression, physical violence, abusive relationships, sexual abuse, vandalism, antisocial behaviors, rape, and even murder. And lastly, the defense strategy of avoidance is adopted by seeking to distract or redirect one's focus through activities, enhance body image, possessions, or competency to cover up the defective self in an effort to disown or disavow the unbearable feelings of shame. And the overuse of the avoidance defense strategy will end up with arrogance, self-deception, narcissism, grandiosity, alcohol, drugs, exercise or food addiction, insatiable wealth accumulation or consumer spending, exhibitionism, comparisons, religious mysticism, truth-seeking or risk-taking behaviors, perfectionism, pathological lying, and inner emptiness. Now, so how do we link these symptoms to the hidden shame? Step one is to psychoeducate the counselee that the manifested symptoms are rooted in the hidden shame through the overuse of certain defense strategies. And with this insight, the counselee will be more open to work with therapists to surface the hidden shame. And surfacing the hidden shame will pave the way for the counselee to trace back the original trauma that congregated the shame so that we can address it as the next part of our strategy. Now, the key is this. Shame has a social nature connected to our need for belonging and be included as part of a social group. When our secured social base is threatened, then shame is evoked within those social contexts. And this takes place whether it involves an actual interpersonal interaction or merely a perceived one when we are talking about it to another person. Thus, hidden shame is more readily accessed by our awareness and emitted when our attention is directed at the social context involving some interpersonal interactions, whether real or imagined. And let me illustrate this, how we surface the hidden shame with Adam. Supposing we are exploring with Adam on his maladaptive behavior of hiding from God. And we asked Adam, Adam, please tell me more about why you want to hide from God. Or Adam, apart from your fear, what other emotions do you think you want to hide from God? So the social context of Adam's interpersonal interaction is with God. Or as we explore with Cain on surfacing his hidden shame. And we are talking about his maladaptive behavior of murdering Abel. So Cain, can you tell us more why you want to murder Abel? Cain, you say that the reason you wanted to murder Abel was because of your anger and sadness. They're so unbearable to you. Apart from your anger and sadness, what other emotion do you think made you want to murder Abel? So the social context of Cain's interpersonal interaction here is with Abel. And to bring it more up to date, in surfing the shame with a counselee, we can ask the counselee a question without a social context, like saying, Mr. A or Miss B, why do you often say, I'm never good enough? Or we can ask the same question incorporating a social context. You say that if you are in class where the teacher asks for a volunteer to present a piece of homework given to all students, you will often not volunteer to do it. If I ask you why, will you say, I feel like I'm never good enough? And therefore, we see the social context here. The social context of the counselee's interpersonal interaction is in the classroom with his classmates. So how do we resolve that hidden shame? To do this, we need to understand the neuroscience aspects behind this. Shame is hidden and stored in our memories. Memories are formed by the reactivation of a specific group of nerve cells called neurons through the persistent changes in the strengths of connections between them. The persistent change in the strength of the connections is termed as synaptic plasticity. Neurons that fire together, wire together. Past toxic shame memories can be restructured through the creation of a healthy reparative memories as alternative routes for the synapses to travel on when shame is triggered. Now, the good news is that we can create the healthy alternative routes without reliving those events in real life. Neuroscience researchers have found that mental imagery can change our multisensory perceptions. In other words, our imagination can create reality at the neuronal level. So to be effective, shame memory reframing through imagery has to be experienced as real as possible. The experiencing is the key for its effectiveness. And to resolve the hidden shame, we adopt a process called shame-informed psychotherapy. And what is shame-informed psychotherapy? Shame-informed psychotherapy is a treatment intervention which is applied following or alongside the contemporary evidence-based counseling or psychotherapy modalities and protocols to address the presenting psychological problems before attempting to address the shame as its root cause. Addressing shame as a supplementary second-level intervention is more appropriate because most people do not seek professional help merely over their shame, but over some other psychological manifestations, without having a clue that shame is the root cause of their problems. And therefore, the process of resolving hidden shame are as follows. Step 1, focus on the symptomatic intervention of the presenting problems to relieve the suffering, as we have said before. Step number 2, surface the shame from its hiddenness by helping the client to be more aware of how they react in the face of shame. And we do this by putting them into a social context. Third, connect the symptoms to the defense strategy, which is our link here. Get the client to relax, close the eyes, and imagine walking into his past memories. The fifth step is to ask the client to select one original acute shame incident, and we call this the governing sin. Then step number 6 is to ask the client to re-experience the governing sin as real as possible and verbalize the sequence and emotions embedded in the memory. And then finally, ask the client to imagine bringing into the governing sin someone who can rescue him from his acute shaming incident. The purpose is to repair the shame of his original experience, to create through imagery a favorable memory out of the same past shame sin as an alternative route to the memory synapses to travel. So with this approach, the steps given in resolving the hidden shame, we have come to the end of this month's video teaching. I wish to thank you for watching this SSC series. This is session number 4, and the topic is addressing hidden shame. To read real cases of surfacing and resolving hidden shame, kindly refer to our 2 SSC blogs, accessible as shown. This video is made to facilitate our Saturday morning community conversations. If you have any questions related to these teachings, you're welcome to ask them when we meet over Zoom. To receive our latest monthly video teachings, blogs, emails, and links to our free weekly conversations, kindly subscribe to our YouTube channel and to the SSC website. So I look forward to seeing you again. Bye for now.